protection for 2-3 years, but then begins to fade when the child reaches 8 or 9 years. And a dose is recommended in pre-adolescence. And there in particular, what's been found is that with the so-called acellular vaccines, that after 2 or 3 years, that the efficacy diminishes considerably. And so there are efforts to try to improve that persistence of efficacy. And Bionet is one of the companies that is in effect trying to develop a longer lasting acellular pertussis vaccine. There are other companies also working to improve the vaccine for adolescents.
So the last vaccine recommended for adolescents is around what age? Of Tdap or a diphtheria, tetanus, pertussis containing vaccine?
13, 11,
13. Okay. And did I understand correctly that a few years after that last dose, most folks who've gotten that vaccine are no longer immune to pertussis?
Well, most folks is perhaps a bit of an exaggeration, but it depends on the study. But certainly I would say that the high effectiveness that's seen initially after the vaccine diminishes considerably by 5 years.
And what do you mean by considerably?
Well, so it falls somewhere between 30 to 50% protection. So it's not nearly as good as after the vaccine dose is given.
Okay, so after the last vaccine dose in adolescents, 5 years later, only 30 to 50% of people are receiving the CDC recommended childhood schedule are protected from pertussis.
Yes.
Okay. How about 10 years out?
I'm not sure there are many studies that go that far out, but I would imagine that the protection is diminished considerably by that time.
So most adults aren't protected for pertussis?
Not unless they've received a booster dose. But that being said, it becomes complicated because if they are infected with the organism that causes pertussis, even if they are not ill because of it, they will get a natural booster. And so they may not have symptomatic pertussis. Pertussis is not uncommon in adults, but the epidemiology is not as well established as it is for children.
But in terms of protection from vaccination from pertussis, most adults are not protected from the vaccination. You're saying if they're protected from exposure to the actual pertussis. Yeah. Is it bacteria?
Yes. But you have to bear in mind that pertussis as a disease is most important in the newborn and in children. And fortunately, we have very effective means of preventing pertussis in those highly susceptible individuals. Adults will have a cough disease, but they won't die of pertussis. So although we want to protect them as well, the main point of pertussis vaccine is to protect the newborn and the young child.
So is it only really dangerous in the first few months of life, or?
Yes, infants with pertussis may frequently die of pertussis, and that's why immunization in pregnancy is now practiced. In other words, to provide passive immunity to the infant during the first months of life before the infant is vaccinated.
And if the mother had been exposed to pertussis bacteria itself and had immunity that way, that would also confer immunity to the baby?
Yes, but one can't depend on that, whereas if you give a dose of vaccine during pregnancy, you can depend on the antibodies passing to the infant.
Does the acellular pertussis vaccine prevent?
Sorry, say it again?
Does the acellular pertussis vaccine prevent the infection and transmission of pertussis in the person vaccinated with acellular pertussis vaccine?
Well, that's an area of active research. It appears that the acellular vaccines don't protect the individual from carrying the organism as much as the so-called whole cell pertussis vaccines did. But those data are based largely on animal studies, and we don't really have a lot of human data to tell us whether the animal results are true in humans or not. But there is a concern that the acellular vaccines may not protect an individual from passing the organism to another individual, even if the vaccinated person doesn't get sick himself or herself.
What animals were used in those studies?
Baboons.
Why were baboons used?
Why were baboons used? Because they are susceptible to pertussis, and obviously they're close to humans.
Would those experiments be ethical to do with people as opposed to baboons?
Well, I'm not sure it would be ethical to infect someone with pertussis. That would require an ethical committee to consider how the experiment would be done. For example, if someone were infected with pertussis and then given antibiotics soon after administration of the organism, that could be ethical because the antibiotics would cure the individual before he or she becomes ill.
Wouldn't that mess up the study, though?
Sorry?
Wouldn't that mess up the study in terms of?
It would certainly influence the study, but it could allow us to determine whether an individual who has been vaccinated with the acellular vaccine can pass the organism despite that vaccination to another individual.
Has that study been done?
No,
Okay.
it has not yet been done.
In terms of the study that was done with baboons, that study,
Yes.
could that study be done with humans? Do you think any IRB approval could ever be obtained to do that study with humans?
To allow an individual to develop symptomatic pertussis, I don't think that would be approved.
Okay. What was, so in terms of the baboon studies that were done, those are about as good as you're going to get for those studies because you can't do the human studies, correct? In terms of evidence about the transmissibility and infection of pertussis from
Yes, but
after acellular pertussis vaccination.
yes, but I believe that workers are trying to determine whether vaccinated individuals are still colonized by the pertussis organism, If they are colonized, then they probably could transmit to others. I mean, there's a lot of work going on in this field, including developing an attenuated bordetella pertussis, which could be given to boost immunity and in particular to prevent carriage. So, as I said, this is a very active area of investigation.
What was Merck's total revenue from vaccine sales in 2016?
No idea.
Think it was in the millions?
I imagine so, but I certainly have no
Do
knowledge.
you think it was in the billions?
I do not know.
Okay. Do you know what the global sales of vaccines were approximately last year?
My vague recollection is something like 30 billion.
30 billion. And do you know what percent approximately Merck's share of that was?
No,
Sanofi's?
no,
Glaxo? Or
no,
Pfizer?
no.
Combined, what do you have a sense of what percent those four represent in terms of that $30 billion in vaccine sales?
Probably, I would guess, but it's purely a guess, 20 billion,
20 billion with a B.
20 billion.
And I don't need to put it. And the increase in the vaccine market has been due to the fact that new vaccines give higher profits, correct?
Correct.
Okay. Are you familiar with the New England, strike that. If I told you in terms of the $30 billion, and you said approximately, what percent did you say approximately you thought was from the big four vaccine makers?
I said 20. I really don't have an accurate idea, but that's my guess.
20
billion.
Oh, billion. Okay. And you said what percent of that was related from the four big vaccine manufacturers?
No, what I said was that I thought the overall income was 30, but that the big four probably account for 20.
Okay.
But those are purely guesses.
Okay. Yeah, well, then let's do this. Okay. When you say it's a guess, how off do you think you might be?
If it's a guess, how do I know how off I am?
How did you come up with the 20 billion?
Because I vaguely recall having seen a paper with those numbers, but my memory may be incorrect.
Are you familiar with the New England Journal of Medicine?
Yes, of course.
What does an editor for this journal do?
what does an editor for the journal do?
Yeah.
I presume that he edits articles that are submitted to the journal,
Okay. And what does the editor-in-chief do?
selects articles to be published.
Okay. And what is your opinion about this, the New England Journal of Medicine?
It is an influential medical journal.
Okay. I'm going to read you a quote from a Dr. Edmund J. Safra, a professor at Harvard Medical School and a former editor-in-chief at the New England Journal of Medicine, and I'm going to ask you a question about it, okay?
Yes.
So the quote says, conflicts of interest and biases exist in virtually every field of medicine, particularly those that rely heavily on drugs or devices. It is no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reach slowly and reluctantly over my 2 decades as the editor of the New England Journal of Medicine. Are you familiar with that quote?
No.
Okay. Then let me read you a different quote, again by Dr. Angel, and in which she blames the issue that I just quoted, the issues with truth in medical publishing on individuals that use the legitimacy of academia to push pharmaceutical company agendas. Here's what she said about those individuals. She says, quote, "They serve as consultants of the same companies whose products they evaluate, join corporate advisory boards and speakers bureaus, enter into patent and royalty arrangements, agree to be the listed authors of articles ghostwritten by interested companies, promote drugs and devices at company-sponsored symposia, and allow themselves to be plied with expensive gifts and trips to luxurious settings. Many also have equity interest in sponsoring companies." Are you familiar with that quote?
Yes, I think I have read that.
Okay. You've consulted for the big 4 vaccine manufacturers, correct?
Yes.
All right. You're in the corporate advisory boards of numerous vaccine developers, correct?
Yes.
You've received royalties from the sale of one or more vaccines, correct?
Yes.
You're listed as an author. So sorry.
I missed the next question completely.
Have you received royalties from the sale of one or more vaccines, correct?
Yes.
And you said yes. You are listed as an author on at least one or more papers where individuals authoring the papers receive compensation from vaccine makers, correct?
Would you repeat that question?
Sure. Have any of your co-authors on any of the papers that you've published received compensation from pharmaceutical companies?
Presumably, yes.
Yeah. And you've taken numerous trips over the last 30 years to various parts of the world.
Yes.
Okay. I'm going to read you a list of acronyms, and for the record, could you please state what you understand each to be? This way we can have commonality in terms of language. HHS.
Health and Human Services.
Okay. CDC. I know these. I know that you know these. This is just so that when I use the term CDC later, we have it defined.
Centers for Disease Control.
Thank you. Thank you. Have you ever been involved with the CDC?
Yes, of course.
Okay. What's been your involvement?
Well, actually, I was a epidemic intelligence service officer in the 1950s, and I have served on committees. I've attended numerous meetings at CDC. I've worked, or let's say collaborated frequently with people from CDC. CDC is the world's most important epidemiology organization.
FDA?
Yes, I've actually done consultation for FDA and interacted with people on FDA. Yes.
And it stands for the Food and Drug
Food
Administration.
and Drug Administration.
And,
Yes.
and the FDA is an agency within HHS, correct?
Yes.
And CDC is also an agency within HHS?
Yes.
Okay. NIH?
Yes, of course.
That's-
National Institutes of Health.
Right. And you've been involved with the NIH?
Yes.
And how have you been involved?
Served on committees, worked with people at NIH, scientific collaborations.
NIH is an agency within HHS as well, correct?
Yes.
Okay. HRSA?
Not sure.
Health Resources Services Administration,
Okay.
right? They were also an agency within HHS,
Yes.
correct? Any involvement with HRSA?
I don't think so.
ACIP?
Well, yes, the Advisory Committee for Immunization Practices. I have attended their meetings since 1960s, probably.
Have you ever served on the board at ACIP?
On ACIP itself, no.
Okay.
No.
Have you ever served on any board related to ACIP?
The ACIP? I've I've participated in working groups, which they have organized on specific subjects.
And what working groups were those?
Let's see, mumps. Let's see, what else? Mumps was the most recent one. I can't recall for the moment, but anyway, 2 or 3 working groups that they've organized from time to time. A yellow fever was one.
Ever work on a working group for rotavirus?
Actually, no.
And measles?
Measles? No.
Not measles, I'm sorry, rubella.
No, not for ACIP, no.
A different government agency?
No, actually, that was for WHO.
For the rubella.
Yes.
And for rotavirus, did you serve on a committee
No.
for any other governmental
No.
entity?
I need to hear the whole question,
I'm
please.
sorry.
You're answering while he's still questioning, and there's no question in the record.
No.
And for rotavirus, did you serve in a?
You could strike that. It's okay. And WHO stands for?
World Health Organization.
Okay. Thank you. I don't know if I'm going to pronounce this acronym correct. You can correct me if I don't. Is it VRBAC? 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 How does it normally pronounce?
VRBAC. Vaccines and Related Biologicals Advisory Committee.
And that's VRBPAC.
Yeah.
Right? Okay. Any involvement with that committee?
I have testified, but I've not served on the committee.
Okay. What did you testify there for?
On the, at least the last time, concerned the Dynavax vaccine.
Oh, for the company you're on the board for.
Yes.
Okay. And this was to try to seek approval of that vaccine.
Yes.
Okay. Which ended up getting approved.
Yes.
The NVAC.
National Vaccine Advisory Committee.
Okay.
I've given talks to the committee
Okay. About what?
about vaccines.
Fair enough. It's anything in particular about vaccines or particular vaccines?
No, actually, it was more or less general. I was not pushing any particular vaccine, but in relation to the administration and development of new vaccines.
Ever give a presentation about the vaccine market?
About the vaccine market? No.
And so all of the agencies and committees we just listed, CDC, FDA, NIH, HRSA, ACIP, Verback, and NVAC, they're all under HHS.
I believe so, yes.
Yeah. And what's the what about IOM? What does that stand for?
The Institute of Medicine, now the National Academy of Medicine.
Okay. Have you ever been involved with IOM?
Well, I'm a member of the National Academy. So, yes.
Since when have you been a member?
Oh, gosh. 10 years, but that's just a guess.
Okay. What is the National Childhood Vaccine Injury Act of 1986?
Well, that's, in effect, it funds the organization that, what shall I say, receives requests from individuals who believe that they've been injured by vaccines and remunerates them if they decide that that there was a possibility that the vaccine did cause injury.
Okay, so if somebody's injured by a vaccine, this law provides that they submit a claim to Health and Human Services.
Yes.
And Health and Human Services then adjudicates.
Yes.
And those claims are filed in something called the Vaccine Injury Compensation Program, correct?
Yes.
Administered in D.C.
Yes.
Okay. So, yeah, the respondent in those cases is HHS, the Secretary of HHS, and the Secretary of HHS in those cases is represented by the Department of Justice.
Yes.
To defend against claims that the vaccines cause injury, right?
I would say that they determine whether there is a reasonable possibility that the vaccine caused injury. They, I would say, are relatively open and will give an award if there is a reasonable possibility. When this was first organized,
Do you have a study that supports what you just said, or any type of that they're open to giving awards? Do you have any governmental report or any authoritative source, any kind of governmental report or similar that supports the assertion you just made?
well, I don't know. I'd have to look that up.
Okay.
But the principle was enunciated years ago by particularly by the American Academy of Pediatrics, and their idea, which I now think was a good idea, was that rather than have an adversary situation, that they would set up an organization whereby if there was a reasonable possibility of injury, that they would offer remuneration, as opposed to the situation where lawsuits were being filed against companies and having an impact on whether the company would continue to make the vaccine. At a certain point, there were relatively few companies making vaccines. And so this is an idea which over the years I have realized was a good idea, because it removed the, what shall I say, the oppositional part of the story, and made it possible for people who thought that they had been injured to be remunerated, whether or not that was biologically the case.
So is it your testimony that the vaccine injury compensation program is not an adversarial system?
It's an adversarial system in that people have to have some reasonable information base to say that a child, let's say, has been injured, whether it's because of the vaccine or whether it's a chance occurrence, fortunately does not have to be adjudicated under this kind of system.
That's only if it's a table injury, correct?
Yes.
But if it's not a table injury, then the petitioner would need
Yes.
to show that it was the vaccine that caused the injury.
Yes.
Okay. So this is, I'm going to refer to this as the 1986 Act. This is the act that gave vaccine manufacturers immunity from liability.
Yes.
And you have to, yeah. Okay. For injuries caused by vaccines.
Yes.
What is a bacteria?
It's a microorganism which has certain properties. It has a cell wall, and it has DNA within the organism, and it can, depending on what bacteria it can multiply in humans and sometimes cause disease.
Okay. How does it replicate?
It divides. It has mechanisms for dividing and multiplying.
And what is a virus?
A virus is a DNA or RNA molecule with properties to produce proteins and to replicate in cells and make more of it, and is capable of causing disease under certain circumstances.
Okay. When you say replicate in cells,
Yes.
do you mean in the host, the person that it infects?
Yes.
So it takes over the person it infects' own cellular DNA material?
Well, it doesn't take over the DNA necessarily, but it is able to replicate in cells which, of course, have DNA. Not all viruses require that they influence the DNA of the cell, but they all are able to replicate in the cytoplasm or in the nucleus of the cells of the host.
And in that fashion, they will spread from cell to cell?
Yes.
Okay. By duplicating themselves into more and more cells in the body?
Yes.
Okay. And the virus DNA you said it can be either DNA or RNA?
Yes.
Okay. And those DNA and RNA pieces, they provide coding for protein structures?
Yes.
Those protein structures are typically, DNA creates protein structures that are important for regulating bodily functions?
Well, the viruses
I meant DNA in general, I'm sorry.
Yeah. Oh, well, DNA in general, yes.
Yes.
DNA in general codes for RNA, which then codes for proteins.
Okay. Essential for human life?
Yes.
Okay. And is DNA shared across humans? Meaning, is there similarity between the DNA sequence in different people?
There are similarities, yes, and there are differences.
Okay. What percent of, is the similarity is there between human DNA amongst individuals?
Well, there are mostly similarities, but there are, of course, differences. That's why we are each different from one another.
I've read, and tell me if this is not accurate, that human DNA is approximately among individuals 99.9% similar among different people. Is that correct?
Yes,
Okay.
but that still allows for differences.
Right. Some of us have different eye color.
Hmm.
Yes.
Yes?
Sorry? Yes.
Do all humans and mammals, strike that. What is the percentage of similarity between human DNA and the DNA in mammals of different kinds? Why don't we start with primates?
Well, the similarities are in the upper 90s, no doubt, but one has to appreciate that the differences that occur are critical and result in critical differences. So the fact that we're, let's say, 99% similar to chimpanzees doesn't mean that the differences are the 1% difference is unimportant, because much of the DNA actually, the function of most of the DNA is unknown.
Mm-hmm. So humans have approximately, between humans, have about a 99.99% similarity in DNA, and between humans and I think you said chimpanzees, about 99% similarity in terms of the sequence.
Yes.
What about for other mammals, such as, let's say, between humans and chickens or cows, or is there a similarity?
Well, there are similarities, certainly, but there are key differences. That's what I was referring to. Even though much of the DNA is the same, most of the DNA that we have, the function of which is unknown.
And what percent would you say is similar?
With chickens, I don't know offhand.
Cows? Do you know?
Again, I don't know the number, but the point is that it doesn't require a large percentage of the DNA to be different.
Sure. What about guinea pigs? If you don't know, that's
Again,
fine. You can just say you don't know.
I don't know.
Okay. Are you familiar with how the CDC makes changes to its pediatric vaccine schedule?
Yes.
Okay. Have you ever been part of that process?
Not part of the process, but certainly part of the discussion.
Okay. An addition and changes to the CDC pediatric schedule is voted upon by ACIP, correct?
Yes.
Okay. What happens when ACIP votes for a pediatric vaccine to be added to the CDC's pediatric vaccine schedule for universal use?
It is adopted by various medical organizations and recommended to the physicians.
Okay. And so the pediatricians around the country rely on those recommendations to decide whether or not to administer a vaccine?
Absolutely.
Okay. And what about children in the United States that can't afford the vaccines recommended by ACIP?
Well, until the present time, remains to be seen whether that will still be the case. The government pays for those children to receive vaccines.
Okay. Is that called the Vaccine for Children program?
Yes.
And ACIP votes on whether or not to add a vaccine to that program,
Yes.
correct? Okay. And when a vaccine is added to that program, the manufacturer is paid for the vaccine even if the child can't pay, correct?
Correct.
Okay. Do you know what percentage of vaccines, pediatric vaccines administered in the United States are purchased from pharmaceutical companies using federal money through the Vaccine for Children program?
50 to 60%.
Okay. So when ACIP recommends a vaccine for universal use, it will essentially create a liability-free market of millions of children for this pharmaceutical company manufacturing that vaccine, right?
The act provides payment to the pharmaceutical company to manufacture the vaccine. That is correct.
Are you talking about the 1986 Act?
Yes,
Right. And they're not liable for injuries from the vaccines, right?
unless it is the result of bad manufacture.
But not for, if it wasn't, not for design defect claims.
Right.
Meaning you can't sue a vaccine manufacturer claiming that they could have made the vaccine safer.
Correct.
Who comprises the voting members of ACIP? No, strike that. I didn't want the names. Let me ask it a different way. Are the individuals that serve on ACIP government employee?
No.
Okay. Where do these individuals come from?
They come from all over the United States, and they are chosen because they have no conflict of interest. That is to say, they receive no funding from vaccine companies, but are thought to know something about vaccines nevertheless, with the exception of a community representative who is a layperson.
So none of the members of ACIP have any conflict with regards to the manufacture, development, or a vaccination.
Right.
Okay. When was the first rotavirus approved by ACIP for universal pediatric use?
That was, don't remember the year, but my recollection is that was in the 1990s.
If I tell you June 25th, 1998, does that jog your memory?
Yeah, that could be right.
Yeah. On that date, June 25th, 1998, you and your co-inventors, Paul Offit and Fred Clark, had already had a patent on the rotavirus vaccine, correct?
Yes.
Were you at ACIP at the meeting that they first approved the first ever rotavirus vaccine for universal pediatric use?
I believe I was.
Okay. Was Fred Clark at that meeting?
I think he was. I'm not certain.
Was Paul Offit at that meeting?
Yes,
Okay. What was Paul Offit's role at that meeting?
his role. I don't remember whether he was still on the committee or not. I don't remember.
He was on ACIP.
He was on ACIP, yes.
He was a voting member of ACIP.
But I am confident that he was not allowed to vote on the licensure of Rototech or on the administration of Rototech.
For the first, what was the first rotavirus vaccine that was approved for universal use in this country?
Rototech.
Okay. Well, is that the rotavirus vaccine that you worked on?
Yes.
There wasn't a rotavirus vaccine that was approved before that?
I don't believe so. No. Well, yes, there was a vaccine that had been developed at the National Institutes of Health that had been licensed but was found to cause intussusception, and the manufacturer took it off the market.
Okay. Pola Offit was on the committee and voted to approve that vaccine for universal use, correct?
Very likely, yes.
Okay. At the time that he voted to approve that rotavirus vaccine for universal use, he was a patent holder with you and Fred Clark on a rotavirus vaccine, correct?
Yes.
He didn't accuse himself from voting on recommending the rotavirus vaccine for universal use at that meeting, correct?
That's correct, which in a sense was voting against himself, since obviously he was in favor of the vaccine that we were trying to develop. So in effect, he was voting for a competitor.
Mm-hmm. When you have one vaccine for a given disease approved for universal use, wouldn't that make it easier to then have another vaccine for that same disease approved for universal use?
Assuming that the properties of the second vaccine were equal to or better than the first, yes.
So approval of the first one paves the way for the second one, doesn't it?
It paves the way in the sense that if people believe that rotavirus disease is worth preventing, they will want more than one vaccine licensed, so that in case there's a shortage of supply of one vaccine, there is an alternative.
All right, so there's once you have one approved, it's a good idea to have a second one approved then, isn't it?
It is, yes.
Yes. Are you aware of the many other conflicts of interest regarding the vote to approve the rotavirus vaccine for universal use that we've just been discussing? That's been reported in a U.S. House of Representatives Committee on Government Reform report?
No.
Okay. Are you aware that this report found that, quote, the overwhelming majority of members, both voting members and consultants, have substantial ties to the pharmaceutical industry, end quote?
Well, I can't go back to 1998, but at the moment, my criticism of the ACIP committee is that many of the people on the committee do not have a very large knowledge about vaccines, because they are eliminated from participating on the committee if they have any connections with industry. And I understand why that is the case, but it does result in a group of people who aren't necessarily the best informed. That being said, I agree with the idea that that people who are on the ACIP should have no conflict of interest.
What's your notes against your microphone?
Pardon?
Oh, the videographer was kindly advising me not to keep smacking my mic. That's pinned to my tie.
Gotcha.
Last question on this. Are you aware that this report by the U.S. House of Representatives Committee on Government Reform concluded that ACIP, quote, reflects, quote, a system where the government officials make crucial decisions affecting American children without the advice and consent of the governed?
I'm not aware of that report, and
I'll give you a copy.
I do not agree with it.
Oh, thanks. I'm gonna. There are 9. going to hand you what's being marked as Plaintiff's Exhibit 9. Happy to provide you a copy as well after the deposition that you can take home with you.
No, I will be interested in reading this, but I would say two things. One is that CDC certainly recently has lent over backwards to try to avoid people with conflicts of interest being on ACIP. And second, that ACIP meets under public conditions. That is to say, the meeting is open to the public, the meeting is on the web, so that thousands of people literally can observe what goes on at the meeting and decide for themselves whether or not there is any hanky-panky. So although, as I said before, I might wish that people with more knowledge about vaccines be on the ACIP, by and large, I think that they do a hell of a good job under public scrutiny.
Are the working groups, are those also public?
They are not public in the sense that the public does not attend the working group. The working group does report back to the full ACIP, and the working group's presentations are presented publicly.
But the discussions that the working groups have and conference calls leading up to ACIP meetings, those are not transcribed, are they?
They are not, no.
Right. And the members and individuals who participate in those working groups, right, which often lead to what the ACIP then rubber stamps, are permitted to have all forms and do have all forms of conflicts with industry, don't they?
They may, but I would contest the word rubber stamp. I've never seen the ACIP rubber stamp a working group recommendation. Often it's just the opposite.
You've also said that that the meetings are available to the public. You've attended, you said, almost every ACIP meeting, correct?
Correct.
Since, what was it, the 60s?
Yeah, roughly, yes.
And you attended the most recent one as well?
The most recent one being, let's see, that would have been last October. Yes, I did.
Did. Mm-hmm. Were you presented anything at that meeting?
I presented the fact that I will no longer attend the meetings.
Were you presented anything by the ACIP committee?
Yes.
What were you presented?
I was told that there is a gavel with my name on it, that it will be used henceforth at the meetings.
And they gave, so going forward, from this point forward, the gavel that's used at ACIP will have your name on it.
Correct.
Okay. You gave a speech at that meeting, correct?
Yes.
When they posted the video of that meeting on the internet, did they include your speech, Dr. Plotkin?
I don't know, but I suppose they did.
You can check after this deposition on the website and see if your speech is there. We have not been able to find it.
Really?
Now,
Wow.
regularly at
Too bad.
ACIP meetings, you get up and speak, correct?
I often do, yes.
Yeah, so you're given free, you're able to get up pretty much at any time and speak, aren't you?
Yes.
And you don't have to wait for the public comment period, correct?
Correct.
And that's also true of vaccine manufacturers. They also are permitted to get up and come to the mic and speak, even not when there isn't public.
Yes, they are often asked to answer questions that are being discussed.
Isn't it true that they also get up and come to the front to speak even when not asked a question?
They may do so if they have, if it's a discussion about one of their products.
But if members of the public want to speak, they have to wait till the public speaking period, correct?
Normally, yes.
Okay. And when the videos are released, a lot of the conversations that occur between the pharmaceutical representatives and ACIP, do those also make it to the video that's released publicly?
As far as I know, the video contains all of the public hearings. In other words, if somebody comes to the mic, they are photographed, and as far as I know, they appear on the web. I must say that since I've been attending the meetings, I haven't really watched them, but I will in February when they meet again.
So apart from the working groups that occur out of public sight, what other meetings or goings about does ACIP engage in that's outside of the scrutiny of the public?
Aside from working groups, I'm not aware that they do have anything that's not public. I suppose they meet at lunchtime, and I don't attend those discussions, but that's all I know.
Billions of dollars worth of rotavirus vaccine have been sold to date, correct?
I believe so. I'm not acquainted with the sales figures.
Does vaccination create a systemic change in the body?
Vaccination creates a change in the immune system of the body.
Okay. Is that supposed to be system-wide? Meaning, if I get vaccinated in my arm, but I'm infected in my toe, am I supposed to still be immune?
Yes.
Okay. So would you say, is it correct to say that vaccination is intended to create a systemic change in the body, throughout the body?
It's intended to create a systemic change in the immune system of the body.
Okay. And the immune system everywhere in the body?
The immune system is expressed everywhere in the body, yes. The immune system consists of antibody-producing cells and cells that are able to influence other cells.
So can you read back the last answer?
Question. The immune system is expressed everywhere in the body. Yes, the immune system consists of antibody-producing cells and cells that are able to influence other cells.
Okay. Is the immune system comprised of more than antibody-producing cells?
It also also includes what are called T cells that are able to kill infected cells, for example, and to secrete substances that also have an effect on immunity.
Okay. And is that referred to typically as cellular immunity?
Yes.
And the immunity conferred by vaccines that you were talking about earlier is called
humoral immunity, yes.
Thank you, appreciate that. Humoral immunity.
Yes.
Okay. So humoral immunity creates antibodies, and it's called humoral because it originates from the bones. Is that kind of where the name derives from?
Well, the name
I don't know.
derives from the ancient term humors, but in effect it means antibodies that circulate throughout the body and can impact against infecting organisms.
Okay. And the systemic change that we've that you've described is supposed to last years, if not a lifetime,
Yes.
correct? From vaccination?
Yes.
When you say interact with other cells,
Hmm.
when you say that the immunity created by vaccines creates antibodies which then interact with other cells, can you describe that a bit more? What do you mean by interact with other cells?